Dr. Nichelle Gurley, and I'm specialized in prenatal, postpartum, and pediatric chiropractic care, along with prenatal and postpartum fitness and rehab. We are going to review how to sit during pregnancy. This is really important because it can impact a lot of things like tailbone pain, sacral pain, SI pain, different pelvic pain, low back pain, and baby position. So the baby position part we'll talk about right now. A lot of women, and just people in general, when we sit at our desk job and or in the car, we are slouched under, meaning that we tuck our sacrum. So our sacrum is this bone on the back that's triangular, and it tends to be tucked under and slouched on. That can cause the tailbone pain, the sacral pain, the SI pain, and the low back pain. So we really want to get out of that position. We also want to get out of that position because having that tucked sacrum is putting us in a position where we're more likely to have our baby's back go towards our spine. The baby's back is the second heaviest part. So the heaviest part is head, so we'll pretend like head is already down. If the next heaviest part is the spine, with gravity, if we're tucked under, the spine of the baby is going to go to our spine, which can result in a more challenging labor and a more uncomfortable labor as well. So that's occiput posterior. We hear that as back labor. To get and help with that positioning, we want to get into a position where we're not tucked on our sacrum, which can allow the baby's back to rotate towards our belly, which is more of an optimal position. How we do that is we sit on our sits bones, which are these bones right here. If you know yoga, you've heard sits bones. If you've ever sat on somebody's lap and they go, oh, your butt's bony, it's that probably bone right there. But if you reach under and you feel a bony landmark underneath your booty, that's your sits bones. So essentially, I want you to sit in a nice wide stance. Doesn't have to be out here. Wide stance here, firm grounding, and on your sits bones. So from the side, I'll show you. Let me rotate the whole chair. It is like this. It's not slouched back. Having a back support in your chair can help you maintain this position a little bit easier, but I highly suggest staying in this position as best you can. It is challenging at times because our core gets fatigued the bigger our belly gets, but it is important to be on our sits bones. And to do that and not have to use as much of our muscles, a back support can help. Most cars, we usually slouch. It's just how they're designed. So again, I really encourage a back support in the car as well. You can focus on how you sit during pregnancy at any point in time, from the time you get pregnant to a few weeks before you have your baby. It's still important at any point in time. You can also use a stability ball, which let me grab that. The stability ball at work or at home, wherever you're using, is great. But keep in mind that you can still slouch on a stability ball and do your work. So you want to make sure that you roll forward so you're on your sits bone on the ball and have that wide stance. So I'll show that from the front. So wide stance. So right now I'm slouching. If I roll forward, that pulls me more into a position where I have a neutral pelvis. So again, why it matters, if we sit with that slouched tucked under position, it could make for a baby that is OP, so not in the best position. It could also enhance tailbone pain, sacral pain, SI pain, and low back pain, and even exaggerate upper back and how you're positioned there. So again, that's how to sit during pregnancy, and I hope that you'll utilize those tools so that you can have an overall more comfortable pregnancy, but also hopefully help with baby position.